Namaste. My name is Carl Rogers, and I work in the Public Affairs section of the United States Embassy here in Kathmandu, Nepal. The Fulbright program is the United States' flagship international academic exchange program, and since 1946, Fulbright has fostered mutual understanding between the United States and other countries. This year, the Fulbright program marks its 75th anniversary, with alumni serving as leaders in government, the sciences, business, philanthropy, the arts, and education. I also want to wish the Fulbright Commission in Nepal a very happy 60th birthday. Since 1961, Fulbright Nepal has been instrumental in bringing the United States and Nepal closer together. More than 1,300 United States and Nepali students, scholars, and researchers have been sponsored by Fulbright. But no matter what kind of project they complete or where, we hear the same response, that Fulbright is life-changing, and it has a profound influence on their professional lives and the communities that they work with. Fulbright alumni at their very core are leaders. And while this past year has been challenging, the COVID-19 pandemic has not deterred Fulbrighters' determination and spirit. Fulbrighters are pioneering research in the best of the United States and Nepali institutions. They are serving on the front lines as doctors and advocates, setting up clinics, drafting public health policy, and finding innovative solutions to help our communities stay safe. They're using the connections and the experiences and the relationships built during their Fulbright exchange to help inform them and respond to COVID-19 and to improve lives. Recently, Fulbright gathered together a group of alumni to discuss response efforts during COVID-19's second wave here in Nepal. And no surprise, Fulbrighters were thoughtful, proactive, and innovative in their responses. So I want to take a moment and just highlight a few of these alumni and celebrate their incredible efforts. Thanks to Dr. Sangeeta Mishra and her team at Koshi Hospital, who have worked to gather and locally produce resources needed to manage COVID-19.
I had an opportunity to work in two major hospitals in the Nepal, situated in one in the far eastern region and the another one in the central region. On 3rd of March, Government of Nepal, they chose 25 hospitals to start fever clinic or start initial response. I would like to say at that time of point, we didn't had any resources. We could not get anything in the market, and there was a huge havoc in the country. So the first challenge for me was about the PPEs, that is the personal protective equipments. There were no PPEs at all in the market, and we didn't have resources as well. I tried to get some PPEs, and at the most I could get only 10 PPEs, that too on the credit, and we didn't had any option rather than to innovate. So I started thinking about what can we do. So we started with using raincoats. So we could get 40 raincoats, and all these raincoats were shared between the healthcare staff in the emergency and in the wards, and they were actually reusing these raincoats. At this point of time, the private hospitals in the locality, they were closing down, and they stopped their services at that same time. And being a public hospital, I never had a liberty, and I never wanted to close the hospital. At this point of time, we didn't had any sanitizer, so I decided to make my own sanitizer. So it was again another innovation which I did. So according to the WHO guideline, I could buy raw material for the sanitizer, and I'm very proud to say that Koshi Hospital was the first hospital who could produce its own sanitizer, and which was taken it was followed by other hospitals in Nepal. First of all, we started thermal scanning of all the patients who came to the hospital, because we just wanted to segregate these patients. Once after segregation, the other problem was if there was temperature, we had to do a PCR. And at that time, PCR was only available in Kathmandu, which was around 12 hours journey from Biratnagar. We had one machine which was being used in doing viral load of for HIV patients. So we did some adjustment. Some of the instruments we got from the veterinary laboratory, and somehow we started doing PCR at Koshi hospital itself. And I'm really very proud to say again that this was the first public PCR lab outside the Kathmandu. But the major problem was once you get COVID, where to keep all these patients? You cannot keep them in the hospital. And that led to an idea that we need a separate hospital. With the help of local government and with the help of provincial government, the Ministry of Social Development, I could reach out to Chief Minister and asked for granting me one of the old building of National Trading Center, which was not used since last 15 years. And I just asked him if we could use that building for making this COVID hospital, because there are chances if we cannot mix COVID positive and negative, and there will be a high risk of infection. This hospital was just 200 meters away from my home. So I had a huge, my neighbors were really very angry on us, and even they were saying what is the use, because everybody was panicked. So they never wanted that COVID hospitals should be in their neighborhood.
These four are only a few of the many Fulbright stories that we could highlight to illustrate the concrete contributions that the Fulbright program has brought to Nepal in our 60-year history. Happy 75th anniversary, Fulbright.